word. And I want to welcome NRG Physiotherapy, who's joined us today. Chad Nolan is the owner, and he is going to talk all about movement and mobility. And I'm just going to give it away to him, and he can kind of share with you a little bit about himself before we get started.
All right. Thank you guys for joining. Like Whitney said, I'm Dr. Chad. I am owner of NRG Physio. We are a cash PT practice in Brownsburg. We deal 100% exclusively with movers. So runners, triathletes, marathoners, CrossFitters, powerlifters, all that type of stuff. So how many of you are in Whitney's running group?
No,
Not me. Anybody?
not me.
All right. So I just kind of want to get to know you a little bit. Let's start with Amanda. Where are you from, and how'd you find your way here?
I am originally from Fort Wayne, Indiana, but I've been in Indy for 6 years now. I found my way here because Whitney has been a yoga student of mine for, I guess, maybe the past 3-4 years. She got me into my first 5K as my running coach, and then I just ran my first half marathon in November.
Nice.
And yeah, so excited to kind of check this out and yeah, hang out with you guys.
All right. Allison, what about you?
Hey, I live in Indianapolis, and I know Whitney through, we went to the same health coach school, and so I met her through like a local Indy meetup that through HCI, the school that we went to.
Mobility seminar.
All right. Carrie?
So I met Whitney back in high school and reconnected with her a couple years ago, or about a year ago. And so, yeah, I'm just here listening because I just got back into yoga about
Nice.
a year ago and saw her poster up at Studio U. And actually, I've taken a couple of Amanda's classes, and I'm struggling with a little bit of movement. So she invited me to this class.
Excellent. Dawn?
Hi, I live in Indianapolis. I've been working with Whitney since, I guess, February now, as a life and running coach. So I'm training for a half marathon in August.
Excellent. Excellent. All right. Miles? I think you might be muted.
There you go.
Yeah.
There we are.
Yeah. What brings you here today?
I'm Whitney's dad.
Oh, hey, welcome.
And
Okay.
Kathy's on the couch.
Oh, is that who that is back there? There it is. Hey, Kathy, good to see you. And then I don't have a name. Your name up in my top right corner is iPad. How are you, iPad?
It's Lynn. Sorry, I don't know why it says that. Whitney is my niece. So
Okay. Very good. All right. Well, glad to have all of you here. Got some runners, got some yogis, got some family. So a pretty good crew here. All right. So we're going to get started talking about hey, there's another one. Welcome. Megan, how'd you find your way here?
Hi, my name is Megan. I live in Indianapolis, and I know Whitney from back when she used to teach. We taught together like 5 years ago now, so I'm here just being supportive.
Excellent. Well, hope you get a little something out of it today. So we're going to talk about first pretty much the three kind of key elements around mobility. One is why we do it. The other is why we do it the way we do it. And then when is the best time to do it. And this fits into all movement practices. So just, I think something that's important to cover with this group specifically is yoga does not equal stretching, does not equal mobility. They're all three very different things. While yoga incorporates probably a little bit of all three, mobility has a very specific purpose. So we're going to start with what that purpose is. So when we think about mobility is really designed to improve functional positions. So we're talking about things like squatting, hinging, pressing, any of those types of movements, but also things like running, being able to get in the best position possible for whatever movements you're doing. And when we think about human movement, there are a lot of those movements that we consider functional movement that really show up in everyday life. So walking is just a stripped down version of running, but it really requires the same joint mechanics, the same muscle mobility, the same fascial mobility. And so ultimately, just the simple task of walking is one of our most baseline functional movements. And you can develop pain and dysfunction just from walking if you do enough of it. Then things like squatting, not always talking about the deep squat, but just getting up and down out of a chair, getting off the couch. And then things like overhead positions or pushing positions, simple things like reaching up in a cabinet, getting off of the floor. So this is really scalable to anyone and everyone when we're talking about dealing with how your body moves and functions throughout your day. It's not always ramped up to the level of sport or skill, whether that be running, lifting, cycling, whatever it may be. So when we're talking about mobility, our end goal is improving functional positions. So let's just take the squat, for example. That's kind of the king of functional movement. If you can't get in the correct starting position for a squat, that's a postural problem, which means we need some kind of restorative mobility to get into the correct starting position. Then there's obviously the bottom position of a squat, which really highlights a lot of mobility problems for a lot of people, whether it be ankles, hips, sometimes the knee, T-spine extension, being able to extend really well for breathing mechanics and to maintain a good stable spine. And so anytime we're doing mobility, regardless of the tool, it's always chasing better positions, either the start position, the finish position, or both, depending on who you are. And the difference is, yoga, I'm not a yoga expert. I'm not going to pretend to be, but typically yoga is going to be more sustained holds, maybe moving fluidly through some different positions and then sustaining, but it's obviously much different than doing back squats or reaching into a cabinet. And so a lot of people think of yoga as mobility. A lot of people think of stretching as mobility. But the design of those is really not to improve a functional position. They're designed to increase an end range position, which doesn't always have the same kind of equal sign at the end of it. So there's a couple different things we have to mobilize when we talk about mobility. We have joints to mobilize, we have muscles to mobilize, and we have fascia to mobilize. And they're all done differently. Have any of you seen like banded mobilizations where you take the big jump stretch bands and you put around your leg or your arm and you kind of stretch with it? Anybody ever seen those? Yeah. A lot of that was made popular by Dr. Kelly Starrett, founder of what was Mobility WOD, now the Ready State. And that stuff's pretty prevalent when you look in the sports world, especially the CrossFit world. But when you see those big bands, that's dealing with joints almost exclusively. And then you'll see things like foam rollers, peanuts, the two balls that look like they're stuck together, other larger balls, single balls. Pretty much you can go to the store and find all types of mobility tools that are different shapes, sizes, densities. And those are really the tools designed to get into muscles. And then fascia is a little bit different because it responds very differently to how you use it. And I would say most people who are foam rolling incorrectly in that they're addressing maybe some muscle tissue stiffness and pain, but they're disrupting their fascial system at the same time. So you get some short-term benefit, but the long-term benefit of it kind of falls to the wayside. But nobody's doing any education around how do you mobilize your fascia. Like, this is a big, big system within the body. It covers you from head to toe, left to right, inside and out. It's continuous throughout the whole body. And most injuries we know now are stored in the fascia. So a lot of times when we have kinks in the system, those kinks are actually in the fascia, not necessarily in the joints or the muscle tissue. And being able to address the fascia in a systematic way in the direction it's designed to be moved is a big, big deal. It's pretty simple stuff. And this is a lot of stuff that I work on with patients. I'm currently working on developing a fascial mobilization program that's designed to take you kind of start to finish to reorganize the body from top to bottom in a very slow and methodical way over the course of about 2 weeks. So that stuff to come, but Whitney can attest, like, most of what I do is teach people how to take care of themselves, how to mobilize their own tissue. And only now am I recently starting to understand how we need to move the fascia around a little differently. So I'm going to start working on some of that stuff for you guys. But the keys for mobility, we're looking at restoring functional positions, right? Regardless of what that position is, we have basically a test where we say, let's just take the squat again. Hey, I squat down. This is how I feel. I do my mobilizations. I squat again and notice a change in position. That's the idea of mobility. It's to do it in small doses and have this kind of dose response every time you go to it. So for yoga, this is pretty critical. I can't tell you how many yogis I've seen who love yoga, but they sit at a desk all day. And so things like Cobra look a wreck because their T-spines don't arch backwards. People press up off the ground, but their back stays like this. So they get this wicked hinge down here in their low back, when actually everything should be kind of curving in the same direction. And so mobility has a place for all movement practices, regardless of what it is. The idea is just, can we understand, hey, these are the positions I'm starting in and finishing in. Can I improve what the pattern should look like? Same thing goes for CrossFit. Same thing goes for running. So a couple of runners in here. Specifically with runners, I see a lot of mid-back dysfunction, especially those who sit during the day. So they get a little rigid and folded forwards in their mid-back. But then also because the seated position shortens the hip, now we're missing a lot of extension in the hip, the ability of the leg to pass behind the body. And what ultimately happens is the spine, which sits on top of the pelvis, instead of the hip extending fully, the hip gets stuck here, and then the pelvis dumps forwards and makes the low back arch a lot. So I see a lot of runners with low back pain who are missing hip extension. And this is a way to kind of get to the root cause of low back pain. What I preach to anybody and everybody is that wherever your pain is not where your problem is. It's somewhere else. The pain can be addressed where you have it, but to make the pain go away and stay away, we really have to take a more broad spectrum approach to your pain and what you're looking at. The low back pain is typically a source of pelvis, hips, ankles, and the T-spine. And the shoulder is typically a combination of pelvis, neck, shoulder blade, and T-spine. And so there's a lot of these different areas that tie in. And so when we talk about doing mobility, we're looking at improving functional positions throughout their range, but also being able to stabilize those positions throughout their range, but also kind of taking stock of what's going on well above the problem, well below the problem, so that holistically your kind of movement, health, and wellness is at a peak performance. Not to say that we're ever going to arrive at perfect, but if we have some basic targets and understand what the goal is, we can consistently chip away towards those goals. And the better you move, the better you feel. And we like to think 10 to 15 minutes a day of like some small daily doses of healthcare are what really goes the longest in getting you where you need to be, to where you feel good, you move good, you can go out and run, and you're not a mess when you get done. You can do yoga and you're not paying for it for 3 or 4 days after. And so those are kind of the basic ideas around mobility, is understanding what it is, what we're after, and it's having some specific goals for you to understand what you should be doing, how you should be doing it, the way you should be doing it. But then the biggest question I get a lot of times, like, man, I've got so much dysfunction. Where do I start? How long do I do it? We mentioned that 10 to 15 minutes a day. It's easy to get lost in this sea of, oh my gosh, I've got so many things I need to work on. What do I start with? I feel like I should be doing an hour a day. But the idea is, can we kind of seamlessly integrate this into things you're already doing or pretty close to it? So for runners, raise your hand if you are a runner. I know I had some 5Ks and some half marathons. Okay. How are you girls' warm-ups? Be honest.
Slow run until I feel warm.
Oh, good one.
I'll try and walk a little bit, but I do notice that I jump right into the running. I try and foam roll before the walking, but I definitely know I could be spending a little more time there.
Yeah, for sure. I tell people all the time, we could probably solve 80% of people's pain and problems around movement with a good warm-up. And that's the truth. Most problems are solvable just by not going into whatever you're doing with cold, stiff tissue. And I'm glad you bring up that you foam roll before. That's definitely a piece of this conversation, is like, when is the most appropriate time to do these things? And so that's what we'll talk about. And we'll kind of circle back to the warm up in just a little bit. Before I go there, can some of you yogis tell me, is there a warm up, or is it just like, here we go? I mean, what's the standard protocol there?
Like before we go into like yoga, or before we run?
No, before yoga.
Oh yeah, for sure. You definitely need to be warmed up. Otherwise, yeah, you're gonna get some overstretched muscles, I guess, and overworked muscles. So yeah.
So like in yoga classes, there's kind of this pre-yoga warm up that everybody goes through before they get started.
Yeah, for sure. 5 to 10 minutes, starting with lighter movements, and then you guide them into maybe deeper movements within the warm-up movements. So they're growing within, there's like a warm-up within a warm-up.
Yeah.
And then you start to move maybe at a faster pace or to a deeper kind of opening, stretching level.
Yeah, very good.
I'll say too that just to pop in there, is that Amanda's really great about doing that. And a lot of yoga teachers are really great about doing that. But there are classes that I've been to, and Amanda, I'm sure you can attest to this too, where there's not that 5 to 10 minutes of slow, warm up into the, the full practice. And so that definitely changes how your body experiences things. The same with running. It changes how your body is adapting in the, process to get to that full workout and during the full workout.
Yeah. So having said that, have either one of you noticed, like, when you go to a class where there's no warm up, that it's more difficult, and it definitely feels different than a class where you get a solid 10-minute warm up before you started?
Yeah,
Yeah.
for sure. Where it's like you jump in, and it's also not just like physically, it's like mentally, you're just like, whoa, I just jumped in. Like, it's not just my muscles haven't expanded. It's like my mind wasn't totally ready to like jump into it. I'm like, whoa.
Yeah. So it stands to reason that probably
it's like, okay, like I needed.
Yeah, stands to reason that probably for you runners, that you will probably feel a lot better when you get started with a solid 10-minute warm up before you go. So thanks for making my own point. Appreciate that. So back to, when is it appropriate to do kind of some of this mobility stuff? And there's a couple different ways to think about it. So you mentioned foam rolling before, which isn't necessarily bad, but that does decrease the ability of the tissue to contract and relax. So when we think about the body, you have two systems. One is your sympathetic nervous system, which is fight or flight, ramped up, ready to go. The other is parasympathetic, which is sleepy time. It's a downer where it's time to turn off and shut down, not going anywhere. And deep stimulus into a muscle like foam rolling is a downer. It turns the muscle off. It makes it relax. It makes your whole body kind of turn off and relax. And so there's only one time when we want to do any type of soft tissue work prior to our movement practice, and that is if you have pain. So let's just say you've got like knee pain or quad pain. You want to resolve that as much as possible before you get going. And so foam rolling through some painful spots to iron that out, to make your tissue where it functions more normally and not compensates around pain, is definitely something that we want to do. And so that's the only time we should see soft tissue work being done pre-workout, pre-yoga, pre-run, any of that type of stuff. Pain will inevitably make you move in ways that are counter to the way you should be moving. And so exercising with pain, it's a dicey situation. You're going to do it. Inevitably, you're going to do it. But understanding the more you can reduce pain prior to, the better you're going to move throughout the workout, the less chance you have of developing something a little more sinister because you're pushing through the pain. So foam rolling, which is probably the most common form of mobility that people are partaking in, is really best to be done following a run or yoga, because your tissue is warm, it's loose, it's hot. It's essentially the difference of cutting cold butter and hot butter. When you foam roll a hot quad that's been worked and used, it's got good blood flow rolling through it, you can kind of sink in and get to some of those deeper levels of dysfunction a lot easier than pressing into a cold, stiff tissue. And if any of you foam roll enough, you've probably realized if you foam roll a cold, stiff tissue, it gets a little worse as you go. Like as you start sinking into some of those deeper levels, it's like, oh, geez, there's the spot. But it takes a little while for your muscles to relax and get down in there. Versus a hot muscle, kind of get right into it. It's a little more tolerable because things are a little more pliable and loose. And so foam rolling, ball rolling, any type of soft tissue work, we like to save for after, when your body is already kind of loose and primed to receive some of that deep stimulus. The other side of that is after a run, that stuff is great for the unwind, kind of bringing you down off the movement high. Your movement practices is in this sympathetic state up here. And afterwards, we need to do our part in cool down to bring the body back down into this parasympathetic state. So not only is it better to foam roll after just from a kind of a local level, but foam rolling after is also good to kind of bring your body back down to baseline, which so many people don't do. They'll run and then they'll go straight back to work and sit in their desk. And so their body kind of stays in this heightened state while it's sitting still. It's just very hard on the system. So foam rolling, soft tissue work, we like to do after. The benefit of that is 2 or 3-fold in that not only it gets into your tissues a little better, but it also kind of brings you back down to a baseline state. Even if you just do 5 minutes after, it's better than going straight from movement practice to sitting on your rear or, not doing a whole lot for the next several hours. Then jumping back to the banded distractions, these are what we really like to see from a mobility standpoint pre-workout. And this has kind of got a twofold effect as well. Most range of motion limitations are stored within the joint, up to 50%. So let's take the ankle, for instance. A lot of people have ankles like bricks. I'm one of them. So if here's your shin and here's your ankle, really it should have lots of motion, and most people are like right in here, not getting a whole lot. And so improving that, you can improve that up to 50% just by working the joint. And that's where these banded distractions come in, is they distract the joint or they pull the joint into the joint capsule. and it frees up the joint space enough to, sorry, we got some work on the house, or pounding on the wall. But that frees up the joint space enough to allow more freedom of motion within just a couple of minutes. When you compare this to stretching is like daily over a couple of months to get the same range of motion effect as 2 minutes on a banded distraction. So it really is pretty powerful to restore some motion pretty quickly. But the other thing is when you do banded distractions, it upregulates the system. So it's helping bring your body more into this sympathetic state, fight or flight, body awareness. Your muscles are contracting more efficiently around the joint by doing this stuff. So that's when we like to see our banded distractions is before your workout in your warm-up. So it's hard to incorporate into your warm-up if you don't have one. So the first step is to get one. And then the next thing to do is integrate some of this banded work into your warm-up. And so typically I like to choose one joint or maybe two at the most. Each joint mobilization takes 2 minutes. And so let's just say you do both ankles and both hips. You've got 8 minutes of band work. And then let's say you've got 5 to 6 minutes of dynamic warm-up, which is what we like to see kind of pre-game to get the blood flowing, the tissue more elastic and ready to accept load and do some dynamic type stuff. Now you've got a 15-minute really good warm-up that not only warms your body up, but also gets it ready to improve its positions during your movement. So kind of going back to running, the hip requires about 30 degrees of extension for running, and the ankle requires about 30 degrees of dorsiflexion for running. If any of those are limited, then that translates up into the spine, which should stay relatively still during running. So let's just say you decrease your ankle motion by half and your hip motion by half. Well, the other half of that has to come from your low back doing a lot of extending through the pelvis. So integrating these banded distractions through the hips and the ankles prior to a run gets you all the mobility you need for that run to be able to save your spine. Because really it's what we're after. Most compensations during movement occur at the spine. That goes for yoga, it goes for CrossFit, it goes for running. And what you can't forget is, hey, your central nervous system is in there. If you mess up the central nervous system, nothing else is going to go well for you. Any of you ever been down in your back, like down, can't do anything? Yeah, got a couple of head shakes. So that just reinforces this idea of, hey, the spine is something we have to protect at all costs. And the spine is why we do workout modifications. We do scaling back based on what the body can tolerate. And that's why that stuff is so important. It's not because somebody's physically incapable or not strong enough to do it, or their conditioning level isn't high enough to be able to complete the workout with full ranges of movement. It's because we know that when the body compensates, it compensates at the midline. And if we trash that, then the rest of our life is not going to be super great. So all of our mobility practices are designed to improve functional positions and ultimately protect the spine and be able to maintain neutral spine during movement. That was a lot really quick.
Yeah, I was going to jump in real quick. I think that's a great point to make, that when people modify exercises, that it is to protect that functional movement, that spine. And so as you're going through your workouts or, your activity, your daily, just activities, if you're modifying things, I think a lot of us tend to think that that is a big negative, that maybe we're, like he said, not strong enough, or, maybe we're just not up to par with everyone else, and blah, blah, blah. There's a lot of that compare. But remind yourself that it's really to sustain that functional movement and to really keep us in the best position so that we're not having those pains and discomforts and issues that then, filter into other issues down the road. So I think that's a really great point. I also kind of wanted you to share, could you share some, I could too as well, but could you share some examples of a dynamic warm-up? Because you talked about banded work, before, for those, specific joints, then followed by, that dynamic warm up. Can you talk a little bit about some examples of what a dynamic warm up would look like, whether you're going out for a walk or you're going out for a run or you're doing yoga or any kind of activity? What are some suggestions that you would give the group?
Yeah, so definitely for running, two things that I think are critical to have pre-run. Even if you just did these two things until you were sweating, you're going to feel totally different. And that is jump rope and long lunging. Now these things should be done following the banded distractions. So if you're missing a lot of ankle range of motion, you don't want to take off on a jump rope when your ankles are like bricks. It's ideal to loosen those up first. Similarly, you don't want to take off on a run or long lunging when your hips are really stiff and not extending very well. So like hip banded distractions, ankle banded distractions, then move into kind of this couplet of, hey, let's do 50 jump ropes and then 10 walking lunges per side and just repeat, because the two primary things that are active in running are that extension position, but then being able to accept load and then press off through the ankle. And so without jump roping, well, and you can just jump up and down in place. You don't even have to have a rope, but a lot of people do a warm up that warms up their core and their hips and their knees, but they don't do anything to prime the ankle. And that's the key joint that's accepting all the load when you're running. So jump ropes and lunging before a run are incredible. Walking is pretty low load. Don't need a lot of warm up required for a walk. Now, if you are just like ungodly stiff, like if you're one of those who wakes up in the morning and you're stiff as a board and your routine is going for a morning walk, then maybe doing some floor stuff just to limber up and get you moving. That's something that can be done. Things like lower trunk rotations, just getting the body moving through some rotating positions, because that's really the primary in walking is this little gentle rotation. And a lot of people when they wake up don't have it. Yoga, I think yoga warm-ups should be designed around the movements that are going to be kind of programmed out for the day. And that's the same for all warm-ups. Every warm-up should look just like the workout you're going to be doing, because warm-up should be designed to warm up the muscles you're going to be using. So that's a very, very simple example of a dynamic warm-up for running is lunging and jump roping. If you're doing any type of body weight training, and then your warm-up should include, oh, very sweet. Thanks for that. Your warm-up should always include a scaled down version of the movements you're going to be doing for the day. And by dynamic, I mean moving versus a static warm-up. A lot of people like to stretch pre-workout, but that's actually one of those sleepy time activities. It actually makes your muscles turn off and not generate force and efficiency as well. And so we want to do those moving based warm-ups prior to your actual run, yoga session, whatever you're going to be doing. Good with that. And I'm glad you brought up that point about the idea of scaling in people's mind is such a negative thing. And it's very easy. I still get caught up sometimes. We always like to compare ourselves to what other people are doing. And in all aspects of life, that is the worst thing you can do. Don't look at social media. Nobody cares what anybody else is doing. Care about what you're doing. Your movement practice should be your very own, and you should not compare it to anyone else. You should only compare where you are today to where you were yesterday. And that is why scaling is so important, is because you're not going to come in at the same fitness level as somebody who's been doing it for 10 years. And it's okay to look at somebody and say, you know what, that a goal I would like to have would be to be that fit. But you can't be jealous of their fitness because they've put the time in and maybe you haven't. But it's a very slippery slope to think, oh, look at what they're doing. I should be able to do that. They're not scaling, therefore I'm not going to scale. Ultimately, you're going to have setbacks if that's your mentality. Scales are designed to keep you safe develop like movement tolerance and ultimately give you longevity of movement as you develop the conditioning and the tolerance over time. You'll eventually get there, but scaling is designed to protect you from injury, not necessarily to bypass any type of workload or make things easier. The problem with that mentality is people think, oh, well, it's too easy if I do that. But the problem is when things get too difficult, your body changes positions to get the job done, and that's where injury happens. You compensate when you get tired. You compensate when you're not strong enough to lift a certain weight, and that's where injury comes in. And that's why scaling and modification is not only okay, but very important. And so don't think scaling is a bad thing. Scaling is a very, very good thing.
Yeah, great point. And with that being said, I'll just share a little bit of my story for those of you who don't know. When I went to Chad, there was a lot that I had to scale back, modify, kind of all those things with the, strength mobility exercises he was giving me. And so since doing that, and growing in that strength and that, functional mobility, I've been able to, add on things that I wasn't able to do and increase, my just mobility practices to be a little bit, maybe grander than they were. But it's definitely something to keep in mind when you're, facing mobility restrictions and things like that. So, great point. Do you have anything else you want to kind of share before we move into Q&A, just to kind of be conscious of our time?
No, that's just kind of a recap is we do it to improve our functional positions, because if we're missing positions, we compensate, and that's where injury happens. We like to do banded distractions before and soft tissue work after. And then there's just 3 different ways that we do work on mobility. It's not just joints, it's not just muscles, it's also fascia. And without kind of this comprehensive system to reorganize all 3, you're going to have minimal results. And that's why we like to do each one in a different way. Something I do want to add that I didn't mention is with soft tissue work, particularly foam rolling, it's better to go across the grain than it is to go along the muscle tissue. This saves your fascia from getting disrupted, but gets into the muscle more effectively. So like if you're rolling the quad, you want to windshield wiper over the foam roller in the tender spot versus steam rolling up and down through the tender spot. This gives you that muscle release that you need, and you can also add movement into that, but it doesn't disrupt your fascial planes in the direction they should be going. So we'll jump into Q&A. All questions are good questions. It's not just about mobility. I can answer any questions about any topic so long as it's within my realm. And who's to say what my realm is? I don't know.
Yeah. Let's just kind of open it up. Just unmute yourself and go ahead and ask. Like he said, nothing is off limits. If you've got a discomfort, pain, concern, go ahead and ask your questions, because the likelihood that you're experiencing some kind of pain, probably somebody else in this, webinar today is as well. So Allison, I saw your hand first. Do you want to go first?
Yeah. So, hey, Chad. I actually, like 3 weeks ago, I'm pretty sure it was a pinched nerve, because it was like the most excruciating pain that I've ever felt in my back, my low back, and it's my lower left side. It's kind of funny. I was doing like a simple yoga for kids with one of my girlfriends, with her daughter. And then afterwards, I was like, man, something feels off, and I couldn't bend this way. I could still bend down, but when I would try to kind of push my hips forward, it sent out sharp pain. And then it kind of progressively got worse through that pain. But then the next day is when it got really, really bad. And towards the end of the night, I tried to take a bath with Epsom salt, and I did that. I actually my back spasmed on me, and then I just laid in the bed for the rest of the evening. And then it got to a point where I had to go to the restroom, and I couldn't stand on my feet. I had to crawl to the bathroom. It was terrible. So anyway, it's been about 3 weeks. It's definitely not 100%. Last night, the left side started kind of bothering me, and it's actually bothering me right like it feels like it's going kind of down the leg a little bit. So yeah, so I've just been trying to do very like little yoga, like your most beginner yoga, in the last like 2 to 3 days.
Yeah. Where down the leg is it going? Be as specific as possible. You already said it's kind of lower left, but then where is it? Side of the leg, front of the leg, back of the leg?
More, yeah, like down like the back of the leg, I would say, like towards like the left side.
Okay.
Is where I feel it. At least today, like last night and today is where like this is kind of a newer symptom of it, like just kind of bugging me.
Yeah. Does it feel a little better when you move a little more?
Um,
When you quit?
yeah, I guess so.
Yeah. How is it just sitting here?
That's when it's bothering me more. Like I'm getting really like irritated sitting down.
Yeah. So to be honest with you, it sounds like pelvis. Pelvis is a super common. Most low back pain that I've ever seen out of 4 trillion patients is the pelvis and not the spine. The spine was designed to take a lot because the most important stuff is in there. So the amount of times that it actually gets messed up to the point that causes lots of problems, in my opinion, is pretty small. But that doesn't mean it's not any less painful. It doesn't mean that it can't happen. And it doesn't mean that you don't have something going on. Most of the time, that's the pelvis. If I had to guess, I would say based on the things you're into, you probably have a hip restriction that you may be a little unaware of, or maybe you're not unaware of it. Do you have one side that's worse than the other? Like a difference in mobility, one hip versus the other?
Yeah, I would say my left side always bugs me. Like doing squats and stuff, like I always feel like something's like, I'm like something's off.
Something's a little off, yeah.
Yeah.
So that's typically what it is. The pelvis is pretty easy to reset. If you want to get with me after, I can kind of walk you through some things that will be a little more specific to what you've got going on. Yeah.
Okay.
But yeah, definitely sounds like pelvis. Definitely a solvable problem.
Yeah. Okay, cool. I'd appreciate that.
Yep.
Yeah, and at the end of this, we'll go ahead and have Chad share his information, and then I'll send out an email with how you can connect with him afterwards, just to kind of follow up on any of these questions. Anyone else have a question they want to ask? Go ahead and unmute yourself and feel free, or type it in the chat too. I've got the chat open so I can see and I can kind of share. Carrie, I know you had a question. Do you want me to ask or do you want to go?
No, I can. So mine has been long-term. I'm a hairstylist. I don't know if it's because of me doing hair. I have shoulder rotation issues, but it doesn't seem to be shoulder. At first I thought it was carpal tunnel that just stemmed all the way up, but now it feels like it's more in my collarbone area. When I do yoga, especially sometimes I have a lot of problems with putting any pressure on my wrist because it seems to feel bound in my collarbone area. A lot of tightening, and almost feels like it wants to, like a ligament wants to pop almost. Yeah.
So I've seen probably 5 or 6 hairstylists, and your positions aren't too much different than kind of the desk bound person, and that you're somewhat kind of hunched over, arms kind of meeting in the center in the front. And so people in your position a lot of times have some very similar problems to some of my desk bound patients. And the result of that is the tissue in the front gets so tight and bound down that it makes it difficult to get in a good extended posture. And what actually runs right underneath your collarbone and down the arm is called your brachial plexus, which is the 3 large nerves that supply your whole arm with its nerve supply. And so I hear what you say a lot, and it's typically one of 3 things. One is that your pec minor is short. Pec minor goes kind of from the bottom of the collarbone down to the rib cage. And if it gets really tight, it rolls the shoulder forwards and compresses the pec minor and puts pressure on the nerves as they pass underneath it. It kind of Number two, which goes along with that pretty frequently, is trigger points in the back of the shoulder blade will refer pain all the way down the arm and into the hand, and it mimics carpal tunnel. The next one is if you've got any rib dysfunction up in this area, which is pretty common as the shoulders start to roll forwards. There's a muscle that's in the side of your neck, and that's actually where the brachial plexus passes out of the spine. And when it gets tight, its pain referral pattern is down the arm into the front of the chest and can even put some pain back between the shoulder blades. Do you have any of that?
Oh yeah.
Yeah. So
All the time.
that's called the anterior scalene. And if it gets a little janky, then it can put pain in all of those areas. And it's pretty common when the body starts taking on this little more forwards and rounded position for anterior scalene to get really short and get some pretty gnarly trigger points in it. So probably definitely have some muscular stuff to sort through, some fascial stuff to sort through, maybe a little bit of joint, maybe some ribs or maybe the shoulder joint. But most of the time when I see a pain pattern like what you described, it's typically a muscular problem, which is a good problem to have. Much better than like a nerve root or something in the spine. Very easy to get into that stuff on your own and make really good progress just with some basic self-care at home.
Okay, great. Thank you.
Yeah. Throw up.
Awesome. Anyone else?
Yeah, I'll go. I don't have video on, but I got a easy one, I think, for Chad. This is Shane.
Is this also Becky?
What?
I don't see a Shane anywhere. I see a Becky.
No, this is Shane Agnew. Did I say it right?
You got it.
Shane.
Hey, Chad.
What's up, man? There's usually a slot for audio only. I don't even see one.
Oh, yeah. I just got back from a run. I didn't want to share my sweat with you guys. So an easy one for hip mobility. What are your favorite laying on the floor, watching TV stretches?
Ooh, that's a good one. My number one favorite, and they go in this order to be done together in this order, is rolling the single ball in the hip and working your way kind of all the way around the fan of the hip. So if you find the big bone on the side of the hip and you start in the back, kind of where the bulk of your butt muscles are, work through there and then over the top of that bone and then into the front of the hip. There's a little short beefy muscle there called the TFL. It is my favorite to roll through all that stuff.
So just lacrosse ball size or softball size?
Lacrosse ball size. Or no, sorry. Softball size, definitely for the hip.
Okay.
Something a little bigger. This lacrosse ball will kind of just disappear into the muscle tissue. And then it's a little too small as you start working around to the front. So softball is pretty good size for that. Then following the scrub is pigeon and hip flexor stretch. Great little combo while you're chilling out in front of the TV.
With the hip flexor, you mean like in a deep lunge, couch stretch? What type of hip flexor stretch are you referring to?
The deep lunge is good. If you want to amp that up a little bit, you can go into the couch. That ties in a little bit of the quad and some of the fascia in the front, a little more aggressive, but can definitely do one or both of those.
Cool. Awesome.
Excellent.
Thanks.
Yeah, thanks for jumping in.
Thanks, Shane. Anyone else? I know, Dawn, you had mentioned you had a question when we were in a session earlier. Do you want to share?
Sure. I just completed a round of physical therapy earlier this year due to pain in my left knee. I thought it was from an old fracture in my left ankle from about 4 or 5 years ago, but the PT I saw said that it was because I had some weakness in my left hip. So we went through some exercises for that. My question is there a way to identify weakness on one side of the body before it gets to injury?
Yes. But before I jump down the rabbit hole, I'm just going to get super truthful with you.
Yeah.
And this is common because it's what people are told, but pain is never a result of weakness. You know, I've treated 98-year-old women who are weaker than skim milk, who can barely get out of a chair, but they don't have pain. And so I think it's poor education on a PT's part to say you're weak and thus you have pain, because strength is unrelated to how the body feels and functions regarding pain. I would say a better stance to take is you've got limitations around the knee that cause you to move in ways that are making your muscles appear weaker. So muscles aren't inherently weak. They get turned off because of some type of compensation pattern, or they get turned off because of pain. But the chances that you develop pain because you're weak are pretty small. I actually deal a lot with people who have gone through rehab and not had great results. It's almost like a little sub niche. And so to think that you can solve knee pain just with basic strengthening doesn't make a whole lot of sense. Especially you look at people who work out all the time and have pain. These people are incredibly strong, but their knees hurt. And so we really have to trace this back to what are your restrictions around the knee? What does your ankle mobility look like? What does your hip mobility look like? Because there's a better chance that your hip isn't actually weak, but it's stiff and doesn't move appropriately, and it just doesn't function through a full range of motion. But then also looking at, what are your movement practices and what are your positions when you are moving? Because if your knee is in a bad position while you move, then you're almost certainly going to develop knee pain. If your knee feels fine today, but you move poorly for the next 6 months, you're probably going to have knee pain in 6 months. But to answer your question a little more specifically is we really have movement targets. And I alluded to this a little bit, and that is with the knee, we have positions that we like to see the knee in. That is directly related to the position your foot is in. And so I can't tell you how critical it is to look at the feet when dealing with the knee. Did your last PT look at your feet?
No.
Your problem, honestly, is probably in your feet, because if you can't maintain a good foot position while you move, then your knee is going to be all over the place. And your foot and your hip are directly connected. And so if you got funky feet, you're almost guaranteed to have a funky hip. And that's probably why your hip tests weak, but it's probably a result of some weird foot stuff going on. That may sound weird, but it's the truth. But we have some ideal positions that we look for during functional movement. And if you aren't hitting those positions, then we can correlate that to whatever pain you might be having. Can you tell me real quick where the pain in the knee is?
It's usually like at the top of my kneecap.
Okay, yeah. So almost 100% of the time, pain on top of the kneecap has to do with the knee shooting forwards too early in bending movements, whether that be squatting, running, lunging, whatever it is. That means you're not initiating the movement at the hip, you're initiating the movement at the knee. And so it bypasses the hip altogether. What happens is it interjects a lot of load right onto the top of the kneecap rather than absorbing all that load through your hip instead. And that can be a result of poor mobility in a lot of places, or just not understanding what's the best way to move and how to correct that. So we do have some ideal positions that we like to see in, and that's the ways that we can understand where should we go with your rehab, but also how can we prehab, how can we minimize risk of injury moving forwards, and come up with kind of some more specific solutions around whatever it is you've got going on.
Awesome. Thank you so much.
Yep.
And this is why I love Chad, because he's always going to tell you how it is. He's always going to say, this is how it is. Even if you've seen somebody else who's told you differently, he's going to tell you how it is. That is how I started working with Chad, because he told it to me like it was. He said, I don't think you need surgery. And he was right, because here I am a year later and I didn't have surgery and I feel better than I felt in years. So it's one of the reasons I really value working with him. Let's take one more question before we end here, just so we stay at our kind of hour time frame. Anybody else?
He pointed at your mom.
I know. No, yes, going once. Okay. Well, we'll close out. Yes, Chad.
I want to give one more little piece
Yes.
that blows people's minds because it's phenomenal. And that is about fascia. And that's why I'm super pumped up to come up with this program and get it to people. If you think of fascia in your body like your shirt, how it works is, look what happens if you kink up the shirt. Where is the area of effect? It's from shoulder to shoulder and hip to hip. So fascial restrictions are the real deal. You got to iron that stuff out. Like, I haven't taken enough steps in the right direction towards fascia until recently. I'm just starting to understand how valuable it is to really understand this stuff and tie it in. But it really drives home this idea of, hey, your knee is not your knee, it's somewhere else. Because when you have kinks that you're feeling at your knee, let's say this is your knee. Well, hey, look, I got this kink over here at my left hip that's causing a problem over here in my right knee. And that's the real deal. And now that I've kind of taken the deep dive into this stuff, I've been able to solve more problems a little more effectively, not just by looking above and below the site, but further off the site. And so the shirt thing really just kind of ties in this idea of, oh yeah, this stuff really comes from everywhere. And we need to take a little more broad spectrum approach how we're dealing with patients and movers.
Yeah. Awesome. Well, Chad, why don't you tell everyone where they can find NRG Physio, and how they can connect with you after this if they're interested in kind of getting more in depth with their question or anything maybe they didn't ask but comes up later.
Yeah, for sure. So the website, nrgphysio.com, that's just, you'll go there and find more ways to get in contact with me. You can email me directly at chad@nrgphysio.com. Feel free to text me or call me at 903-413-8117. And that's honestly the best way. I do want you to know that I am well prepared for COVID. So I'm not seeing people in person right now for obvious reasons, but I have a pretty robust system to take care of people at home, which looks like telehealth consultation for what's going on. And then I can make custom content online, feed it directly to your phone. So a lot of this stuff we've talked about, I can get to you without seeing me in person, which is proven to be pretty effective right now. People tend to have a lot of free time on their hands. Their schedule's a little lighter. And so it's my opinion, it's a great time to kind of focus in on yourself, take control of the things you can control during a time where not much is controllable outside your own four walls. And it's a good time to start developing some of these movement and mobility habits that you can kind of reintegrate into whatever new normal life is when that starts to shake out. So even though we're not seeing in person, we can get you anything you need right to your phone in a pretty good way. And I want to offer you guys something for jumping on today, is I'm working on the new fascial mobilization program. If you guys are interested, I'm going to give it to you to try out. But you're going to have to give me something first. I need pictures. So if you're comfortable taking some pictures and willing to send them to me, then I will essentially do a body reading on your pictures, kind of see what's out of level, what's a little off kilter, and then I'll make a custom video for you to do self-fascial mobilization to push it all in the right direction, and then we'll redo a body read. This is something I'm going to develop as a product and sell to people, but I'm looking for some guineas. And so if you're interested in that, I can promise that it will be awkward to take these pictures in your bathing suits or your compression shorts or whatever, but I can promise that if you do it and commit to it, you will feel better. And so if you're looking for a little something to move you in the right direction at no charge for now, I'd be happy to do it for you, because I need to kind of figure out what's the best way for me to get this to people. So if that's something you're interested in, text me, call me, email me. We can kind of hash out the details, and we'll get you going. Sound good?
Yeah, awesome. Thanks for that offer, Chad. Yeah, thanks so much for being here. It's been a pleasure to have you and all of your knowledge. And definitely, if you're interested, connect with him via email or at his website or his cell phone. I've put all the information in the chat. Again, that's Chad at nrgphysio.com. And his cell is 903-413-8117. And he is very responsive. So texting is
most of the time.
Yeah, I mean, I would say 98% of the time. You know, we all have that 2%. So thank you guys for showing up today. It was great to have you, and we look forward to seeing you again. So have a great day, guys. Thanks, Chad, so much.
Thank you, guys. See you later.